Thanks, Olivia. Hi everyone, thanks for joining today. So my name is Hayley Durnall. I'm a consultant in public health here at Worcestershire County Council. And I've been asked to talk to you today to give you a bit of an overview of the current situation of where we're at regarding COVID-19 in Worcestershire, and then share with you some of our lessons learned from outbreaks that we've seen in businesses across Worcestershire. Also, I've got a brief slide to discuss lateral flow testing with you, because I know we are being asked by a lot of organisations about lateral flow testing at the moment. So I'm happy to take any questions on that later on as well. So I've got some slides for you. I'll just share them with you. Bear with me one moment. Not sure why they're not showing up. Let's try again. Oh, there we go. So there we are. So can you see that, Olivia? Can everybody see it? Yeah, fab. Okay, right. So this graph shows quite nicely the situation in Worcestershire and puts a bit of perspective as where we are now compared to the start of the pandemic. So this blue line is the cases of COVID-19 that we've seen in Worcestershire. The first bump that you can see, that's the first wave back in March, April, May of the pandemic. And then the second bump is the second wave, and then this steep incline now. I think officially we're still calling the second wave, but the interruption in the middle was due to the lockdown that was introduced before, so I think it was November, December time. As you can see, overall in Worcestershire we have seen over 20,000 cases, and in the past 7 days we've seen an increase overall of 52% in cases compared to the previous 7 days. So these are the rates by district in Worcestershire at the moment. As you can see, we're at a rate of 555 per 100,000 at the moment, and that's broken down by district. The highest district at the moment is Worcester City, which is at 747 per 100,000, and that's also seen the highest rate of change in the past 7 days. So that's seen an 87% increase in cases in the past 7 days compared to the 7 days previous to that. The highest rate in the over 60s is also seen in Worcester City, and that's at 561 per 100,000. So we keep our eye on that rate because we know that cases in the older population, in the over 60s, are those that tend to result in more serious disease, including hospital admissions. So you can see there we've got quite a lot of variation across the positivity in the county, although the positivity overall is quite high. And then we can see that the number of cases per district are in the first column. So the red columns are rates, so that's the cases per 100,000 population, and then the first column is the actual number of cases themselves. So you can see we've had over 3,000 cases in Worcestershire in the last week. So this graph now is basically the same data represented in graph form, just to show you the trends and the patterns. So we can see since Christmas we've seen this steep increase, which obviously has been reported on nationally, and each of the colours of each of the districts. So the highest one at the moment, as we mentioned, is Worcester. We are just starting to see the rates slightly plateau, so it's a bit early to say, you know, it's calming down. It's definitely not. We're still at very high rates at this moment, so I wouldn't want to give any false sense of security around that. However, we are just starting to see them settle slightly. However, they are obviously settling at very high rates, and it's left undetermined as to what's going to happen, if it will continue to increase or if we will start to see it settle a bit more now as a result of the national lockdown. So we're keeping our eye on that very closely. These are the rates split into more detail by age group. So I thought this would be of interest to this group because overall in the county you can see that the highest rates are in the 20 to 39 age group, and actually across the age groups you can see that it really is the working age group that are perhaps, it's difficult to say driving the transmission, but are resulting in the positive cases, because obviously we don't know who's got it without symptoms and not being tested. So of those who are being tested, the highest proportions we're seeing in that working age group. And if you look at some of the rates by age group, by district, they're extremely high. So if you look at the 20 to 39 age group in Bromsgrove, they've got a rate of over 1,000, over 1,100 per 100,000. So they're extremely high rates that we're seeing in those when you break it down into the smaller populations. This is a slide just to show how we compare locally and regionally to other areas. So Birmingham have seen a 51% increase in the past 7 days, and their rate is at 751. Warwickshire, which we normally compare ourselves to as a similar county, we've traditionally been a bit lower than them all the way through the pandemic, but they're now lower than us at 413 and have seen a much lower rate of increase in the past 7 days. However, we are being told from nationally that we are seeing some of the highest rates of increase in areas that were previously in tiers 2 and 3 prior to the lockdown, which is what, as you're aware, what Worcestershire was. So the All England rate at the moment is at 629 per 100,000, and the West Midlands is it's quite comparable to that at the moment at 616 per 100,000. So this is a slide I wanted to share with you, which really drills down into local detail. So I know there's a lot of information on this slide, but the link is at the bottom, so I'll ask Olivia to share the slides afterwards and you can access the data on the link. Now this data is updated daily on the link, and it gives for each of the districts the rate and the number of cases for the last 7 days for the middle super output area. And on this slide they're ranked, so you can see the real hotspots in your area, of obviously where your businesses are and particularly where your staff are coming from as well, because all of the cases will be reported according to the address of where the person lives, so not necessarily where they work. So it's just important to bear that in mind when you're thinking about where your staff commute from. So that's the overall view of the epidemiology and where we are at in Worcestershire at the moment. So unfortunately it's an increasing picture, and this is not something that we're expecting to go away in the short term. We are obviously optimistic with the vaccine coming in and that being rolled out as quickly as possible. However, we believe it's going to take a sustained amount of time before we start to see an impact from that vaccine. So I wouldn't want anybody to have a false impression that by March this is going to be going away, because that's definitely not what we're expecting. So it's really important that you stay on top of your game with your COVID secure controls. So some lessons that we've learned from outbreaks. So I'm going to discuss some lessons, then I'm going to just quickly talk about lateral flow testing, and then Helen from Worcestershire Regulatory Services has got some specific points around risk assessment and some of the common things that we're picking up that are problems with businesses' risk assessment. So lessons learned from outbreaks. These are just some key things that I've picked up as being part of the local outbreak response team, as things that where businesses are falling down and things that are resulting in outbreaks. So car sharing is a big one, and I know this is in Helen's points as well, that if the guidance around car sharing is that really it shouldn't happen unless absolutely necessary, and ideally it should be just within a support bubble or within a household. If you've got 4 staff members who are commuting together in a car, the transmission rates are extremely high in vehicles, so it should be discouraged. And if you do have to have people coming together in cars, I would advise that you keep those people within any bubbles that they're working with at work, so that if you do get a case in that car between 4 people, you're not spreading it across 4 bubbles across your workplace. Break times is another one. So we've seen, it's a real shame, we've seen some businesses that have been really good with their risk assessment, they've had really good controls during the working day, and then just at break time everybody mixes together and forgets about it all. And this is becoming less and less, because I think it's becoming learned as we go along, but this is something that we've seen cause quite significant outbreaks, unfortunately. Also, clocking in stations seem to be a bit of a pinch point, either just physically where they sit within the organisation, that they're in sort of quite an enclosed space with lots of people queuing up and not necessarily sticking to social distancing, or the physical touching of them, that there's no wipes available to clean it down after use, or sanitizer for people to clean their hands with before and after use. So those are just little things to bear in mind. Making cups of tea for each other has been a real big one, and I know I do sound like the fun police with this, and it's not it's not nice telling people not to make each other cups of tea, but it's such an easy way for the virus to spread. Like, you're touching everybody else's mugs, you're touching the cutlery, especially if you're physically giving the tea to people as well. And it's something that obviously in British culture we do for each other. It's how we get each other through the working day, but it's just something we really need to discourage at the moment, unfortunately. And kitchen areas in general have been seen to be linked to transmission, because a lot of businesses will have quite small kitchen areas, so they're either allowing too many people into that area or not having sufficient cleaning in that kitchen area to prevent transmission. Shared cutlery as well. So ideally, unless you've got a dishwasher on site, people need to bring their own cutlery. But even if you have got a dishwasher on site, really, we would advise people bringing their own cutlery in, because if everybody's going into that cutlery drawer to grab the cutlery and touching every bit of cutlery inadvertently, then you are going to potentially have more transmission that way. Also, shared sweets and treats, so boxes of roses from Christmas, and all the brands are available obviously, boxes of chocolates and cakes and things like that being brought in. That's obviously not great practice. You just asking for one person to have it on their hands and then leave it on all of the other chocolates in the tin, unfortunately. And then other general behaviour as well. We have had some really just not sensible behaviours happening, and I'm not finger pointing, and we do know that COVID fatigue is a real thing. Like we are experiencing that people it's just too much to keep up with these things all the time, which is why you need to have that really good championing within your organisation to make sure that people are sticking to the rules as much as possible. But some things we've heard are that people have been blowing up balloons in the office, pinging them around and then just exploding them in people's faces. Well, that's essentially a COVID bomb, isn't it, really? And I'm sure nobody on this cause organisations would participate in that behaviour, but these are just some things that we have picked up, so just to bear that in mind. Smoking and vaping areas as well, we know that's a good one for people going outside sharing cigarettes or stood next to each other having a chat while they're having a cigarette. I think one thing with that as well is just to bear in mind that people forget how far 2 metres is, because it's quite far. So I think having some materials that visualise that, and I know from the council we put out some comms around, can you fit a bath in between yourself and somebody else, because that's 2 metres, or a Highland cow even. So 2 metres is, 6 foot. It's quite a significant amount of space, and I think people think it's shorter than it is, unfortunately. And then the other classic one that we've seen a few times is people's leaving parties. So we've had 2 examples of this I can think of off the top of my head. One is where the person who was leaving actually was infectious and hugged everybody at the leaving party and managed to infect the majority of people on that team, unfortunately. So that's one to avoid. But also another one is that the organisation had really good controls in place, and then everybody came in together for the leaving party and just sort of forgot about the rules for half an hour. And then we saw quite a high hit rate with that example as well. So these are just some things that probably just might even be really obvious to you, but just to highlight that we're seeing things like this, unfortunately, and they are leading to high rates of transmission within businesses. So next I was going to just briefly discuss lateral flow testing. So lateral flow testing in Worcestershire, we are expanding the programme at the moment. We have had 3 pilots, one of which was at the university, one of which was in Redditch, and another one is at the university at the moment and is also supporting a couple of educational settings as well. They've been really successful pilots, and we've taken a lot of learning from them on how best to roll it out widely across Worcestershire. We have got a plan in development at the moment that will involve 3 mass testing sites within Worcestershire, and we are also hoping to bring some community pharmacies on board as well to do testing. So we are getting lots of organisations ask if they can do lateral flow testing themselves, which is great. The only caveat on that I would put is that unfortunately at the moment we're unable to issue lateral flow testing for use as it's being used in the NHS. So in the NHS I know that staff members take the kits home and test themselves. However, that's limited to the NHS at this moment. Obviously, things change really quickly, so there may be some changes in the pipeline. But currently, we can only work with the business to provide lateral flow testing for themselves on site by setting up essentially a mini testing centre on site. And unfortunately, with that comes all of the responsibilities around quality assurance and clinical governance that you would expect with a testing centre. So it's not a straightforward process. If any of you are interested in doing that, I'm happy to talk to you. I believe we are going to set up something within the council of compiling a list of organisations that are interested, and I think perhaps I'll run a webinar in the next week or so to explain exactly what's involved. and then afterwards I can speak directly to any organisations that are still really keen. But obviously organisations will have access to our wider community testing as soon as that's rolled out. However, it will at the moment be prioritised for key workers, including blue light services. So yeah, we're working on it as quickly as we can do, and then obviously if people have got any suggestions around that, we're happy to take those on board as well. So that's around lateral flow testing. So just another point around lateral flow testing really is that lateral flow testing cannot be used as a substitute for good practice, because it's not as sensitive as the PCR testing, which is what's standardly used in the community. So if you book a test online now because you've got symptoms, you'll have a PCR test. So PCR tests, they're extremely sensitive, and they will pick you up throughout the majority of the progress of your illness, whether you display symptoms or not. Lateral flow testing won't. It will pick you up where you are at the highest point of producing virus within your body. So if you've been whereas you would have been if you're slightly past that high peak of virus production within your body, you could potentially still be infectious, but you won't be picked up. You'd only be picked up on a PCR test. However, they are good at picking people up when they are infectious, so that's a good point. But it's just to sort of bear in mind that they're not as sensitive as the PCR tests, and you can't just rely on them for information to say, oh, everybody's negative, because they're a good indicator that everybody's negative, but they shouldn't be a replacement for good COVID controls in the workplace, and they also shouldn't be a replacement at this point, guidance-wise, for people isolating. So we are seeing trials of that going on in schools at the moment, but nationally, if somebody's been a contact of somebody, they still need to isolate. So there's been no guidance to say that lateral flow testing can replace that at this time. Obviously, things change really quickly. It might change, but we're keeping our eye on that situation. So that's all from me. Helen, there's some points here from you regarding risk assessments.
Yes, hello. Oops. Yeah. Sorry, didn't want to distract from Haley, so switched the video. Hello, everybody. I'm going to cover some of the stuff that, Haley has already mentioned, but in a little more detail, and specifically linked to the risk assessments, which all of you are legally required to do. And if you've got more than 5 employees, to write down that risk assessment. And this is where what I'm going to go through is a list of things that have come up as common failings in written risk assessments, which are obviously leading to infections or poor practices. Now, Pete is also a health and safety specialist. He at the moment is leading on enforcement, so may want to make some contribution at the end. It's my team that are specifically working with the health teams when we get outbreaks, rather than enforcement monitoring of businesses. So this is all very much geared up to things that have been identified during actual outbreaks when we've called in risk assessments. And at the moment, some of you may be HSE enforced for your health and safety. However, in Worcestershire, we have an agreement with HSE, the principal officers, that we can make initial assessments of risk assessments, but if there are key issues, we will then refer on to HSE to further explore, give advice in writing, or visits, or even in some cases, if there's major outbreaks, call an incident management team, which will involve all parties. So all what I'm going to say has come out of those sort of routes, meetings, discussions, etc. So I've put this list up. It's been very simple form, and it is not, although it's numbered, do not take these as priorities. They're just as things have come up doing it, and some of these may apply to other risk assessments you do as well. Particularly number 1, we find that a lot of risk assessments, and they're not the easiest thing to do, although they seem so on paper, they're often written in what we call generic language, where people use phrases like frequent, where appropriate, consider, regular. These are not acceptable words in health and safety terms. You need to be specific. If you say something is regular, to me, it might mean every 3 days. To somebody else, it might mean every hour. It is what the company decide. So you need to be very detailed, saying that touch points are cleaned every 3 hours, or every time somebody uses a specific piece of equipment or desk, etc. So that's one big lesson to take for general risk assessments. There are also risk assessment templates on the HSE website as well to help you through this process. But do remember not to adopt them generically as written. You have to assess your own workplace, because health and safety law is written for all workplaces, whether they're large or small. But principles of COVID infection are the same whether you've perhaps got 4 people at work, or preferably not at work at the moment, or whether you've got a very large workplace, except the risk is obviously increased the larger the workplace. Hayley's also mentioned about the pinch point of signing in, which often seems to be forgotten, not least pen sharing, for example. Pens tend to get passed around between people. And Hayley's already mentioned the importance of shared contact with familiar items that we don't even think about. I, for one, have certainly turned down pens that have been turned and offered to me in places. So make sure you carry your own pens around. The other big one, and again, Hayley's picked it out, is changing areas, lockers, staff rooms, kitchenettes, toilets, smaller office corridors. Lots of companies seem to fail to assess these. They think about the actual workplace or the equipment room or the kitchen, you know, in a food business or production areas, but they don't think about all the other areas. And you've still got to control people, particularly with social distancing, when they're moving through these areas. Now, it's entirely up to you, obviously, the numbers and restrictions you put on, but they're all places that we've picked up where the virus has been passed on. Many of you may have mechanical ventilation alongside natural ventilation. Getting a good airflow is really important to control COVID, which is why it likes, of course, is all indoors in the winter months. So you need to think how your ventilation system works, and in some cases whether it's actually blowing out dirty air which could contain the virus rather than natural airflows, because not everywhere manages their ventilation systems particularly well. We've also had one major outbreak, at least, where a business used an enclosed space with no ventilation, and whilst it practiced social distancing, people came and went from the room, and about 15 people eventually went down to COVID and were trapped back to that particular source. And we reckon it was because totally unventilated room, and when people went in the room, the door was closed as well. So COVID must have been very happy in there. Hayley's also mentioned about cleaning of touch points. You need to say as and when, and provide the relevant cleaning materials really for them, whether it's wipes. And you need to be aware that not all wipes may be effective against COVID, but general cleaning and, of course, soap and water. The virus hates soap and water, it breaks it down. Although obviously with electrical equipment, you need to be very careful with soap and water. But you need to think about this sort of detail when you're going. Touch points again has been mentioned by Hayley. Shared equipment's been mentioned by Hayley, but take it down not just to kitchen, but to other equipment you might share, computers particularly. There's plenty of data pre-COVID to show that computers were often a source of bacteria and things because they don't get sufficient cleaning, and nearly everybody eats or drinks at their desk and puts sticky fingers over everything. So if you brought the virus to work, you can hand it on. So what's your policy process for cleaning computers between use? And again, I briefly mentioned cleaning products. You need to determine what cleaning products are used for your specific business and to ensure that they're appropriate for COVID cleaning. Hayley may have some comment on appropriate cleaning materials as well. You need to look at something that's virucides, basically. And not all are, but if you're using cleaning companies, they will be able to advise. Next one, Hayley. Thank you. Yes, sanitizers, the big one is common, particularly in food premises. Not all sanitizers are instant effect. You need to be aware of the contact times for sanitizers where you're using them. I'm not talking about hand sanitizers here particularly, I'm talking about cleaning sanitizers. Some of them have really long contact times. Some of them are up to 5 minutes, otherwise they're ineffective. talk again to your cleaning companies or read the labels if you're buying your own to make sure it's clear. And if you're using dilutable sanitizers, make sure you dilute them as per manufacturer's instructions, or you might as well just be wiping down with dirty water. But a really important one that often does causes problems. Jumping about, again, one-way systems are not always detailed in premises. Lots of premises have got one-way systems. I'm sure you've all been in supermarkets and seen one-way systems on the floor and people going in every direction. They can be difficult to enforce, but in business premises it's a bit easier because there's not quite such a movement of people going through, and you have control over those people. And people will turn back thinking they can get back quickly, but they certainly need to be marked out. This is a big one, bubbles and cohorts. One of the very common problems, and again, Hayley's mentioned, breaking people down into bubbles for working, or cohorts if you prefer, is really important. Otherwise, you can end up with the whole business closed down because everybody is deemed to have been a close contact and has to isolate. And bubbles separated down on particularly production areas, food premises and other manufacturing have proved to be very effective in controlling staff work loss time. You have to work it out according to your workplace needs, and then you need to carry that through, not just the bubbles on the actual floor, working floor or desks, units or whatever, but you need to separate them all the time, whether they're going into the canteens, serve them going into kitchenettes, or between, say, using a kitchen, that you need to clean between those bubbles using them as well. So you're reducing the risk of infection. Talked about cutlery and crockery and kettles and all the rest of it, and I'm sure you've picked up that message. Another common area is that while you all think of your bubbles working separately, you then find that managers are moving around between the different bubbles and moving into and out, and therefore breaking the bubbles. So how are you going to deal with that issue of managers going in? Should they, they need to maintain distance, but they certainly shouldn't be getting close up. And how do you deal, say, with somebody who's working quality control in a factory who will probably be moving from area to area? And obviously first aid. Now there are, as you know, some exemptions for urgent first aid about close contact, but you might just need to take it into mind. Next one is, you've got social distancing. It needs to be properly managed. Now, managers aren't always there on the spot. So do you, through your bubbles or cohorts, have a COVID champion or warden? How much use do you make of your CCTV? Gosh, it reveals some strange things going on in business premises. At times you can see people going in all direction, and don't forget, in this, car parks. Staff will gather together in car parks which are on your premises as often as not, and you still have some responsibility, but they all come out of work having been very good with their bubbles till then, and suddenly you'll see a bubble of 6 suddenly sort of blow up and become a bubble of 20 all together in the car park. And as Hayley said, COVID fatigue is now a problem. People are perhaps a little more careless or just fed up. So all your management needs to cover breaks, smoking shelters, the pinch points, photocopiers, vending machines. And again, back to risk assessments, your management control measures is often not detailed enough. Who does it and when. And Hayley's mentioned very clearly, I think, travel to work arrangements, which I think was a bit of a shock for all of us, really, because most people who do risk assessments don't necessarily think about travel to work. It wasn't something you had to think about before because it didn't have an immediate impact on your business until they walk through your door. Unfortunately now, if people are, say, car sharing or being brought by bus from areas of the country that have got very high COVID rates, you'll often find that infection's been brought in that way, and cause certainly considerable problems for the food industry, particularly in early days before we all learned the lessons. Also, you need to specify about your training, how people use their face coverings and visors. Not just putting on, but as has been mentioned, constantly touching your face and taking masks up and down, wearing a half mask. Every time you touch your mask, if somebody's infected from somewhere, you put yourself at risk. And I'm sure we've all been around supermarkets seeing people, you know, with their masks just sort of under their noses rather than fully worn. It's something that needs to be monitored. It has got a lot better in businesses. I think that one's come under control. And the last one that's come to light several times, and you need to think about for your risk assessments, is some people have, in this day and age, they have more than one job. So they might be working for you part-time, but the other rest of the time they might be going to somewhere else that's even higher risk. We found one where somebody was working in a care home, but their other job was in a supermarket. So you've got this risk of infection. So one thing you need to know more than ever is what your workforce do, and their job distribution, personal movements. It's become much more intrusive because of COVID. So that's sort of the general list of things that have come up time and time again, and I hope it's helpful. There's also just one thing that came out in a couple of investigations was later. Yeah, I'm sure a lot of you run the NHS Track and Trace app. And we all take our mobile phones to work, and we often have them on at our desks and whatever. If the phones are too close to somebody else's and somebody is pinged because they've been in touch with a COVID case, it may then bounce around all the other phones. So suddenly one person's notified and you suddenly discover the whole office appears to be a close contact. Now, we would have no way of knowing which was that first contact necessarily. So it'll end up, and it has ended up in a couple of cases, where everybody's had to isolate, you know, taking a whole bubble out or whatever, and it could cause major problems in some situations. So you need to just think about managing your staff and what they do with their personal phones during the day. Some companies have said you can't have them on your person. That may be a little bit extreme in some cases because it's another restriction on freedom. But and some places, workplaces, of course, ban them altogether. But just have a think about that. Well, we've had 3 or 4 incidents where that's happened. And again, that was something new. And that's the end of my bit. Hayley?
Thanks, Helen. I'll just completely reiterate that point around the app. So the app's really useful. It's got its uses. It's helpful in identifying close contacts of cases. However, we just need to remember that it's based on where your phone is, not where you are. So if all of your staff have their phones in their coat pockets or their bags, which are then together in a staff room or a locker area where they're under 2 meters apart, if anybody does test positive, all of the phones will ping. And we've seen this, and we've seen it affect significant numbers of staff in particular organisations. So it's just something to really bear in mind what people are doing with their phones, really. There's another point I was thinking about, a common sort of myth that we have to bust with a lot of businesses, which is around normal face coverings. So face coverings are great, they've got a place, but having a face covering on does not negate you from having to keep that 2 meters distance. You still are required to do that. So if you have somebody test positive at work and they've had a face covering on, but they've been in within less than 2 meters of other staff members, the other staff members will still need to isolate. That face covering doesn't prevent them from having to isolate. So that's just a common misconception that we get presented with. But yeah, that's probably it from me. So I'm happy to take any questions, or I don't know, Pete, if you've got anything that you wanted to add. Or
Thanks, Hayley. Yeah, I think if this webinar had happened, 2 weeks ago maybe, I'd be speaking lots and lots about things like Scotch eggs and salads and vertical drinking at bars. But thanks to the most current lockdown, my team are a little less busy, although where there are transgressions within the retail and the hospitality sector, of course, we're quite busy dealing with those things. Hayley just mentioned about face coverings and the 2 meter separation distance still being essential, really. And that's what we're seeing in supermarkets, or certainly it's something we're concerned about, that all of a sudden people feel in themselves, this is customers now, that wearing a face mask and someone else nearby wearing a face mask means they're quite safe. So we're trying to push that message with the supermarkets to try and encourage staff to have less people in the store in the first place with the traffic light systems where they've got them, but also to ensure that that customers are adequately separated and there's one-way systems, etc. I've got to say, we're lucky in Worcestershire. The vast majority of businesses, and again, that's retail and the hospitality sector that I look after currently, are doing really, really well, complying with regulations. But we've got a small, literally a handful of premises or businesses where there are breaches. Some of them are quite significant. So whereas before we would have been in advisory mode, we're now in enforcement mode. And of course, I'm not going to talk about particular cases, but that's where we're at the moment. So yeah, I'm hopeful that the vaccine rollout happens sooner rather than later, and we can all return to normal. Thanks, Hayley.
I think that's a great note to end on, that we'd all like to get back to normal as soon as possible. Thanks, Pete. Thank you, Hayley, Pete and Helen, all for your input. I have been keeping an eye out on the chat area. There's been a couple of comments in there, but no direct questions as of yet. So I guess just time to open the floor up, really. If anyone's got any questions, if they want any advice, while we've got some people on hand here, please take up the opportunity. So we've had a question. Hayley, do you want me to read them out and then you guys can assess who maybe is best positioned to answer? Okay.
That'd be great, thank you.
Okay, so first question is the percentage of positive tests increasing?
Yes, so I can answer that. Yes, it is. Yeah, across the board.
Okay. Any other questions, guys? Either put them in the chat, or if there's not loads, we probably can come off mute. Raise your hand. John, is that you?
Sorry, my mic was on mute then. There's just a question really around the antigen testing. We've had a couple of quite large employers contact the chamber this morning actually around setting up antigen testing on their premises, and also whether there'd be any funding towards them actually doing that. Is there any more information we could get on that at all?
So when you say antigen testing, do you mean the lateral flow testing? So so antigen testing just means testing for the disease. So I assume you mean the rapid turnaround, the lateral flow testing. Is that what you mean, John?
I think there was some government announcement. I think it was Sunday or even Monday morning about. I think that was more around the antigen testing. And doing that on premises, but again, I imagine people are looking at both that and the lateral flow testing as well.
Yeah, I think it is the lateral flow testing by the sound of it. Yeah, so there is the answer is it's all a bit up in the air at the moment. So there is funding for for councils to roll out community testing, and we do know that some businesses are linked directly in with the Department of Health and Social Care to provide lateral flow testing on site. So this is something that we're sort of looking at and trying to make it work the best that we can, really. There's a possibility that we can offer the lateral flow testing on site for organisations, but again, as I mentioned earlier, it will be down to those procedures that need to take place and the clinical governance and quality assurance that would be expected with that. So I think if people are interested in that, I'm happy. I don't know, Olivia, if you'd be happy to collate details of those people and send them to me, and then we can come back to you and work with you in the best way that we can. It might be that we submit the list of interested organisations to the Department of Health and Social Care and say, look, these are the ones that are really keen to be involved, what can you do for them centrally? Or it might be that we can look at how we could make it work on an individual business level with you.
Okay, yeah, that's great. Thanks, Hayley. I think what I'll probably do is, John, if I give you Hayley's contact information, you can maybe touch base about the examples that you've had.
Yeah, perfect.
Just going back to that, John, I don't know whether you want to get in touch with Helen Glass from Carndine as well. She's just put in the chat that they're currently using antigen testing on site at the moment. So
it was Helen. Helen was one of the companies that have reached out this morning, along with a couple of others. So yeah, I'll certainly reach out to you, Hayley, with a list of a few companies that are looking at this.
That'd be perfect.
Cool.
Thank you. Just to raise as well, there's the point about antigen testing being for people who've had the virus and still have it in their blood. That's antibody testing. So the antigen is the virus itself, and the antibodies are what's produced by your immune system to stop the virus within your body. So people who are immune to COVID have antibodies against it, which is why there's antibody testing, and then the antigen is the virus itself, so it's quite a bit different.
Thank you, Hayley. I've had a couple of other questions, if that's okay, whilst we've still got a little bit of time. Someone's just asked with regards to the first question about the percentage of positive tests increasing. Do you think that this is because it's now easier to get a test?
So there's a difference, yeah. So if we look at that curve that I showed at the start, where you've got the slight bump for the first wave of the pandemic and then it's increasing massively now, those bumps, if you like, those peaks aren't really comparable, because we know that now there is much more availability of people to access testing than there was previously back in March and April, when it was really only the hospitals that were doing testing. However, if I think it's due to people being able to access more tests, I think the actual positivity increasing is just due to the fact that there's more virus circulating. The number of tests that people have taken, I think that's reflective of the availability of the test, but the actual positivity, that I would say is more linked to the amount of virus that's in the community at the moment.
Okay, thank you. Hopefully that answers your question, Emma. And final question that we've got at the moment is from Ben. If there was a large outbreak in a manufacturing unit, as an example, how long would it take for Public Health England or the authorities to come out and test all of the staff?
So it could be turned around really quickly, and we've seen it turned around really quickly for various different organisations. We've got a local community testing team that will come in and test people. Their priority at the moment is adult social care, obviously care homes, but if we've got a large scale outbreak going on, we could get a team in, but also we've got access to the mobile testing units. There's a regional supply of mobile testing units that was such as what was used at EVG when there was an outbreak there. We brought a mobile testing unit in to test all of their staff, so within days it could be turned around really quickly. And it's just really important that if you are experiencing cases of COVID-19, that they are reported to the local outbreak response team at Worcestershire County Council. That's how you access the expertise on controlling the outbreak, and we do that with support from Helen's team as well in WRS. So it's just really important that we're notified, and then if that mass testing is needed, we can turn it around for you.
Amazing. Hopefully that helps you as well then, Ben. Has anyone got any final questions? I'll just kind of go over my summary points then. If anyone's got any other questions, feel free to put them in. We still have got 10 minutes, but to give you time to type, just want to say a huge thank you to all three of you for joining us this afternoon. I know there was a lot of information, and as Hayley said, I am happy to share the slides with everybody that's in the group so that you can have a look at those figures and statistics in a little bit more detail if you want to. So I'll send that this afternoon alongside some other useful webinars that I think might be of benefit with kind of this in mind. Has anyone got any final questions? Okay, great. Well, a huge thank you to all of you for attending then, guys. I really appreciate it. Oh, sorry, one more question. Yeah, this will be available on YouTube within 48 hours. We've sort of got a process of downloading it, sending it to our marketing team, and then getting it on the YouTube channel. So give us a couple of days in it, and it'll be on the Chambers YouTube channel. Feel free to share it and post it wherever you want if you think anyone else would find it useful. We're here to help though, guys, so if you need anything else from us, you know where we are. Give us a shout. Lovely to hear from you all and see you all, and hope to see you again soon. Thank you very much.
Thanks.
Thanks. Take care, everyone.
Bye.
Bye.
Perfect, thank you, bye.